Hi, I'm Jamie, and I am at my doctor's. This is Dr. Gregerson.
Hi.
And I am here for trigger point injection, so he's going to speak a little bit about that. So with Sjogren's, you probably have muscle pain, joint pain, and my muscle pain got so excruciating that I came to Dr. Gregerson, and by the way, he's the one that even diagnosed me and found that I had Sjogren's, which is awesome. I know a lot of you takes years and years. Anyway, my shoulder pain, my neck pain, it actually shoots up into my skull, was so bad that I came to Dr. Gregerson and said, is there anything? And he said trigger point injections, which, I try to avoid any kind of anything, but, so he gave them to me the first time, and I was pain-free for like 2 months. And I had been living in so much pain that level of freedom from pain was amazing. So for quality of life issues, I'm continuing to do it. So I just kind of wanted to video it and show you what it's like to get trigger point injections. And maybe Dr. Gregerson can tell you a little bit more about it and why it helps so much with muscle pain. Do your thing.
Okay. Well, what we're using here is a dilute solution of a numbing medicine called Marcaine. We do dilute it 50% with saline. And then the reason it's cloudy is because there's a small amount of a long-acting steroid. Muscles, when they continually are contracted, there is very little blood that goes into them. And so as a result, in order to make energy and stay alive, it has to make energy without oxygen. And that one of the byproducts of that is called lactic acid. Lactic acid builds up in the muscles, irritates the muscle, makes it want to contract, which then makes more lactic acid, which then makes the muscle contract, which then makes more lactic acid. It just becomes this self-sustaining cycle. And any muscle that's contracted for that prolonged period of time will do that. So it can be caused from things like Sjogren's syndrome, low thyroid, Epstein-Barr virus, Lyme disease, etc. All of these things can have that continuing muscle pain. And so what we're doing with this, first of all, we will find the area of the most tender, the point tenderness. We then inject a significant amount at each site, and that's why we dilute this up so much, so that we can stretch open that muscle. The other thing that we've noted is every area where it's in a tight condition, the muscle has a little bit of an electrical charge difference between that muscle and muscles around it. And if you think about, let's take a capacitor or a lightning rod or whatever, you put metal across those two poles of a capacitor, or you bring a lightning rod down into the ground, it will short things out. And so you can actually take just the needle and put into these areas. I like to think of it as just grounding out the muscle. It's not necessarily what happens.
They call it what, dry needling?
Dry needling. And you can see that this needle is very, very tiny. It's a 27 gauge needle. I've got even smaller ones, but to try to push fluid from a 20 cc syringe through a 30 gauge needle is almost impossible. At least I don't have the strength in my hand to do it. So you either have to go with a smaller syringe or a little bit larger needle. But this is almost the same size as an acupuncture needle. So the way we go about doing this is I will find the area that's kind of feels like a knot, and like right here, it feels like there's something right there.
Almost feels like bone.
It feels like a hard bone. And so a lot of times when we put this in, you'll see a twitch of the muscle. So I'll take the muscle band, put it between my fingers to support the syringe, and then I know right where to poke in, and then it goes in. And she probably doesn't hardly even feel the needle until I start putting in the numbing medicine.
And that even feels weird. It's not painful. It's like,
go ahead.
In some ways, it actually kind of feels good. It's a weird.
You feel it up behind your neck, maybe down your arm.
It literally will shoot down into my leg and foot. It's a weird feeling.
A little twitching right there.
Oh yeah, I've actually never seen you do it this way.
Could be an indication that we are getting the right spot. And then I like to apply acupressure there, and you can feel that spot is now gone. Then we can go find another spot.
Well, we go all the way up my neck.
So we can go back here, these cervical muscles that help.
I might actually have to put the phone down because he's going to have to actually get down and dirty. He does like at least 6 or 8 injections, and I'm telling you, it is worth it. Ooh, that one does. Ooh, that feels so weird.
And then I'll move the needle around as you saw me do it in the first one, because that helps me to kind of, I call it shotgunning it. That way we can get maybe some of the other little areas around that one trigger point that are tender also. Now if I was to take and hit Jamie in the arm really, really hard, she wouldn't notice any of these other areas. But once this pain in her arm started going away, then she would start noticing other areas that were tender. And likewise, when we find an area and we numb it up, well, then she may say, well, but this area hurts. But initially she wasn't complaining of that. She was just complaining of the one area that she was focusing on with most of her attention. So that's why, even though you get one spot, you might have another one right next to it. Like right there, it feels like one.
So is this a pretty safe alternative for Sjogren's patients that are dealing with chronic pain that is debilitating in their daily life?
Now, the one thing is the steroid, I put that in there mostly just to help with inflammation over the next couple of days. You know, I think of these just like when you work out and you've been having muscle pain the next day, and it takes 2 or 3 days for the pain to go away. Well, this is kind of the same thing. This numbing medicine, it's called Marcaine. It lasts for 6 to 8 hours, and then the pain will start to come back. Well, the steroid that's in this will help reduce inflammation, so over the course of the next 2 to 3 days, that pain will hopefully go away. But it's not uncommon to have to repeat this intermittently. And you know, if you're repeating it frequently, you may not want to use a steroid. Steroids themselves, as you know, with Sjogren's can be helpful, but you don't want to be on chronic steroid. And so, you know, if you're putting this in maybe once every 3 months, that's okay. But if you're doing it every week, I wouldn't put a steroid in it.
Right.
So right there's another spot.
Mm-hmm.
Does that hurt?
Mm-hmm. Yeah, it all hurts. I mean, right now, because the steroid is still, you know, lingering, it's not as bad as... I used to be living like at an 8 or a 9 every day. And after he does this procedure on me, I mean, I'm at a 2 or 3 for months. So it's definitely gives me my life back.
And you walk out of here like a bobblehead.
It does feel weird because like it'll numb my ear, and like later at night when I lay down, I'm like, oh, I'm still numb. But anyway, this is really important that you find a doctor like Gregerson. I know a lot of you have a hard time finding a doctor that will listen to you and a doctor that knows anything about Sjogren's. You know, finding the right doctor who understands that it's what's systemic and that it is musculoskeletal and it affects your entire body is so important. Dr. Gregerson spends a lot of time with his patients, and he listens and he answers questions. And he was doing a procedure and he saw that my feet were purple, and he's like, Jamie, that we need to test you for ANA. And then next appointment, he walked in and said, you had Sjogren's. So it was so much easier for me than you guys. And I said, what is that? And he said, it just sucks for you. And sometimes Gregerson will tell me, I don't know. When he doesn't know, he doesn't know. And there's just so much we still don't know. But I'm hoping to continue, guys, to provide information. This has been a lifesaver for my life. So if you're dealing with chronic muscle pain, definitely talk to your doctor about giving it a shot and getting a little bit of your life back. And
no
the hope,
intended.
And yeah, and the hope is that I won't have to do it forever, right? The hope is that I can get some healing through other things, through stretching, through chiropractic care, through deep tissue massage, while the muscle's not spasmed, right? That's sort of the idea, is to get some healing while the muscle's not spasmed, and maybe stretch it out, maybe do things that might help heal it.
Well, yeah, I mean, if you're locked up with your muscles and you can't do physical therapy, this will help you to loosen things up. It's just for those cases where it's where the pain is quite bad. You know, you don't want it to get to this point, but if you are, well, this is one way to start the healing process.
Yeah, if you're living in a chronic 8 or 9, it's a quality of life issue.
A chiropractor, a doctor that has a degree in osteopathy, a doctor of osteopathy, DO, They can do procedures called osteopathic muscle manipulation, or functional, let's see, it's called FDM, functional something manipulation. Anyway, what they talk about that is the muscles are like a tube of Jimmy Dean sausage. And you have this plastic wrap around all the sausage on the inside. And what happens with a lot of these muscles where you get these tender points is you can get a bulging of the sausage meat out through the plastic wrap. And so the idea behind FDM or OMM can be to push that meat back into the sausage wrap, so to speak. So
his analogies are always like about cars or meat or something. Very manly. I love it.
It doesn't do any good to speak Japanese if you don't understand it.
I just love it.
So we have to use everyday examples.
And one more question about muscles. Do we know why autoimmune patients suffer so much from muscle and joint pain?
Oh, there's a lot of reasons. One of them can be just your immune system is attacking muscles. And one of the things we can look at is something called creatine kinase. And if that's elevated, that's letting us know that your muscles are being attacked by your immune system. Just like with Hashimoto's thyroiditis, where your thyroid is being attacked by the immune system, same thing. Lupus is just the immune system attacking different tissues. And
I was telling him lupus has way better PR than Sjogren's.
well, yeah, exactly. And it's been around a little long. Well, it's been around.
Do you think that's one of the main reasons? Because is Sjogren's just newer? Because it's number 2. It's right behind rheumatoid arthritis, but doctors don't seem to know near as much about it as lupus. You think it's because it's newer?
I think
as one of the reasons.
Our understanding of it is not as mature as things like lupus.
Got you.
I think a lot of us that are in primary care who are not rheumatologists would look at Sjogren's syndrome as, let's say, a subset of lupus. And I think in reality it's a lot, it's its own entity.
Yeah.
So.
By the way, they changed it to Sjogren's disease, not syndrome, because of the systemic. And they're actually doing, I guess, some research. But yeah, they changed it, so it's disease. Well, thank you, Dr. Gregerson, and maybe he'll make another appearance in the future because we need more doctors like him that at least try to understand our disease and at least care about their patients. So I appreciate you, Dr. Gregerson. Bye.
Okay.